Many members are joining us remotely. We expect a few more.
So why is it so important that we have basic data on COVID-19 in nursing homes? That's question number one, data. And question number two is, what are some of the policies that we can use to help nursing homes put in place this information and the ample resources?
I think data and transparency are critically important in this crisis. I think often during a crisis, we're tempted to downplay the need for collection of data and prioritize other actions. But it's essential in this case for three main reasons. One, we do need to know where resources need to be directed, and if we know where there are outbreaks in nursing homes, we can direct resources to them, but we can also identify the communities in which the virus is probably spreading.
New diagnostic tests, therapeutics, and vaccines.
As we look back on this crisis, we need data in order to do the hard research to figure out what worked and what didn't work so that we can make better policies in the future. And third, consumers and their families really need to have this information. Anybody looking for a nursing home placement right now or worried about their loved one in a nursing home right now really needs to be able to know what's going on in a very timely way so that they can make their best decisions.
Chairman Collins, thanks very much. I wanted to start with my questions.
I believe that you recommended universal testing for every nursing home resident and staff, which I think is a good idea and have been recommending. How often, however, would you have to do that?
It's very important to test all residents and not wait until residents are asymptomatic, because until residents are asymptomatic, because by then it's too late. There is asymptomatic spread, and given the close proximity and the fact that staff go from resident to resident every day, the virus, until people get symptomatic, can spread throughout the facility.
Yeah, remotely, I see Senator Josh Hawley, I see Senator Rick Scott.
All residents really should be tested, and not only tested, but tested regularly. So what I've heard from geriatricians is generally weekly would be good, at least bi-weekly, so that residents can then be separated and the transmission can be stopped.
Until they recover, they can be isolated and thereby reduce. As we await further development of medical countermeasures, including vaccines and treatments and broader testing, medical countermeasures may need to be tailored specifically for seniors given the differences in their biologies.
Expertise will help us advance public policies to slow the spread of the